So the question about molecular testing for ovarian cancers, primary peritoneal cancers, and fallopian tube cancers has recently changed with the NCCN guidelines, now suggesting we should not only test our patients for germline mutation, but also at the time of recurrence, consider testing those patients' tumors somatically. So we actually can evaluate the tumor for microsatellite instability to see if they're a candidate for immunotherapy. Also, suggesting that we test for BRCA1 and 2 genes and homologous recombination. This may help us inform us about sequencing of adjuvant therapies and maintenance strategies. So selecting for patients that should be tested for germline mutations is real easy. All of our patients with epithelial ovarian cancer, fallopian tube cancer, primary peritoneal cancer should be tested, or at least offered testing for not only to help inform us about their family and cascade testing for their family, but also perhaps for selecting therapies. Selecting patients for somatic testing of their tumor, right now we recommend that at time of first recurrence. So predicting response to platinum therapy is tricky. We can use a few things, like how did they do with their prior platinum is a very good response. The platinum-free interval can help us predict how they're going to do with platinum when we use it for second or third line therapy. But we know that other molecular features like BRCA gene status, homologous recombination defect, probably also help us predict for platinum sensitivity. This is a very exciting time for our patients with ovarian cancer in that we have a lot of new therapies. And one of the biggest categories is PARP inhibitors. We have 3 new PARP inhibitors that, when I say new, some of them have been out a few years, but 3 PARP inhibitors to choose from: olaparib, rucaparib, and niraparib. They all have now a maintenance indication, so we can use them after 2 prior platinum chemotherapies in a complete response or partial response to be used as a maintenance strategy. There are also 2 of the medications have a treatment indication, with rucaparib and olaparib having also treatment indication after 3 lines of prior therapy.